Hi, my name is Lauren Diggins, and this is my Sociology portfolio video. For this project, I chose to spend my time at Lampstand Nursing and Rehabilitation Center, located in Bryan, Texas. Lampstand Nursing and Rehabilitation Center specializes in offering help and quality advanced care for senior citizens either after an injury, illness, or surgery, or if they are in need of respite or hospice care. Lampstand is part of a large statewide organization called Daybreak Venture. Daybreak Venture operates 69 facilities throughout Texas, making them one of Texas's largest providers of rehabilitation and nursing home services. This organization has made a significant impact on the community. They have 40 years of experience, and they have served over 1,000 individuals each year in over 22 communities across the state of Texas. Daybreak's philosophy is clear. We at Daybreak Venture are committed to providing the highest quality of care for the residents in our homes. Respect for our residents and their individual needs is paramount. They also have a mission statement that all of their facilities around Texas follow. It says, "Our mission is enabling people with intellectual and developmental disabilities to lead their unique lives with dignity, independence, and inclusion." Why I chose Lampstand. I have known that I wanted to pursue a career in the medical field, more specifically physical therapy, for some time now. I had always thought I'd want to focus on sports therapy or the special needs niche. When given this assignment, I sought out working with children with special needs as my volunteer organization without hesitation. Many organizations I contacted were filled to capacity with volunteers, and, to my surprise, one organization found my Catholic religion to be a conflict with their Christian beliefs. So I was forced to look beyond my first choice of working with children with special needs. It was at this point that I decided this was the perfect opportunity to broaden my horizons, and I decided to see what helping the elderly would be like. This particular setting, the Lampstand Nursing and Rehabilitation Center, intrigued me because many of the residents there needed rehabilitation, which perfectly aligned with my physical therapy interests. Although I did not work with them in that capacity, I was able to interact with them in a variety of ways. During my hours of volunteering, I played bingo with the residents, passed out their mail, made them popcorn for their movies, and painted their nails. Even though each of these things was so small, I could tell how it made their day so much better, and subsequently mine too. I also helped prepare the facility for special events by decorating the lobby and living room for St. Patrick's Day and Easter and adding candy to Easter eggs. This was always enjoyable because the residents would get so excited. It really brought me back to remembering that it's the little things that sometimes bring the greatest joy. While spending time with the residents, I was able to bond with a few ladies. I always looked forward to hearing what stories they had next to tell. What I've learned. I have learned a new level of patience, one that I think will benefit me tremendously in the medical field. These senior citizens sometimes needed extra time to do the simplest of tasks, such as picking up a bingo chip or moving from the sofa to the dining table. Sometimes they needed extra time to express their thoughts, like the color nail polish they wanted or what snack they wanted with their movie. Sometimes they needed the extra minute to gather their thoughts to recall a memory they were sharing with me. And sometimes they just needed the bingo number called a little louder. I have always been taught that patience and kindness go a long way, and I was fortunate to be able to experience that in a whole new setting. After working and growing close to some patients, I have also learned how truly blessed my family is to be able to be there for my grandparents. I sincerely enjoy visiting with the ladies and gentlemen at Lampstand over the last few months, and I am thankful to have had this learning opportunity. Through my volunteering, I have experienced working with a group of people that are in need of a special care and treatment. It has been eye-opening to work with these people on a closer level, and I feel that it has been a valuable experience to have as a foundation as I began my health classes for my allied health degree. Most importantly, my respect for our community's senior citizens has grown tremendously. These people have given so much and sacrificed so much for our community and our country in the past, and I realize that now that some of them have a significant need, our community has a social responsibility to give back to them and make sure they have a quality care in a comfortable, safe, and pleasant living environment. I find it reassuring to know that there are selfless people out there and caring facilities in our community to help those senior citizens in need. My experience at Lampstand was one that I know will have a lasting impression on me.